Hey everyone, welcome back to Staying Connected, a podcast where I talk to other people with vascular Ehlers-Danlos syndrome, or vEDS, which I also have. Today I have Abby with me in person. We are at the vEDS scientific meeting in preparation for the vEDS collaborative meeting tomorrow, and just so excited that we're here doing this in person. It's always really special.
I know, I'm so excited to be here.
So tell us about your son.
Yes, so my son, John, is 7. He was diagnosed just after he turned 2 years old. So it would have been back in 2014. My husband and I were tested afterwards, and we were not positive, so he's the only one in our family.
And how did you figure that out?
So I'll try to keep it short. So he actually had a lot of issues when he was born. He was my third child, and he just had a lot of things going on. He had some breathing issues, some feeding issues. He ended up needing multiple surgeries for different things going on. He had pyloric stenosis in his stomach, which he had to have surgery on. And he had a lot of eye issues. He had feeding difficulty. He had a really small jaw that he had to have surgery on. There were just a lot of things that it just seemed like once we kind of had one thing figured out, something else came up. Mm-hmm. And so we were actually seeing the craniofacial team because of his jaw. And I requested a genetics consult, and, kind of like everyone else, was told, no, he's fine. Had been told by, the pediatrician multiple times he's fine. He had lots of bruising. And then, so one thing led to another, and then we were actually told by the first geneticist we saw that he was fine. Mm-hmm. And then the other geneticist that was actually his fellow was in the room, and she was younger and about my age, and I think she, just by looking at him and everything I was telling her, and at that point I was really adamant. I knew something was wrong with him. Mm-hmm. Because he was my third child. So, it wasn't, my first time in the park. I knew something was wrong with him. And so it took us a little while. And eventually, right before he turned 2, we did a connective tissue panel. She knew he had a connective tissue disease, but just didn't know which one. But vEDS was not on her radar. Mm-hmm. And we drew his blood and did the testing, and he came back positive for vEDS.
And that was when he was just before 2 or at 2 years old?
So his birthday's in December. He actually had his blood drawn right before, he had his blood drawn right before his birthday. So it would have been in 2013, so right before he turned 2. Okay. And then it took quite a while. It was like 11 weeks.
Wow.
To get his results. And he was actually, the hospital that we use in Omaha, they had actually just started doing the whole connective tissue panel in-house. Mm-hmm. And so John was actually our geneticist's first patient that she ever diagnosed, and he was the first patient at that hospital ever diagnosed.
Wow.
They had started doing it in-house, and they actually repeated it multiple times. And before they even, she told me for sure he had it, they sent his stuff to Dr. Byers to make sure. Mm-hmm. And then she called me, and I knew it was terrible because she called me on her lunch break on my cell phone and had us coming up there 2 days later on her lunch break for an appointment. So I knew
it was bad.
It was bad. And I asked her, I said, is it one of the bad ones? And she said yes. And I knew, I had taken the paper home, and I had researched a lot of it, and once I knew it was one of the bad ones, and I got back on it, I knew he had vEDS.
Yeah.
I knew he had it by the pictures, the issues he had with bruising and his skin splitting, and I knew he had vEDS.
So that was on the list of things that they tested for, and you looked into it after you got the call?
Yeah.
Okay.
Yeah.
So tell me about the skin splitting, because you mentioned that a little while ago.
So that was when, so I was always like, I would say, I always kind of we went through 7 doctors before, that I kept saying, like, I thought something was wrong with him, but I felt like I was always kind of like, no, he's fine, he's fine. Like, I would bring things up, like he would get bruising on his legs, fingerprints from me changing his diaper, and like, no, it's normal. From the pediatrician, like he would have I would go for an appointment and I would bring up, he had bruises on the top of his feet and on his ears, like places that just little kids don't get bruises. Because at this point he wasn't even mobile. And it was always just, no, he's fine. Our pediatrician talked about, maybe he had like an underlying bleeding disorder, like von Willebrand's was brought up. But, there's nothing like really that you can do about it anyway, so there's no point to test him for it. And I brought up, like, on his forehead, he had like very prominent veins on his forehead. And I remember like bringing all these things up, and he's like, no, it's fine. Everything, like, but then it got to the point after he became more mobile and started walking more, he would bump his head on things that weren't, you wouldn't think that would cause an issue. And his skin just started like splitting. Just like gashing open from these small almost bumps that, little kids, like they would fall and bump their head on something not sharp, not, and it just didn't make sense. And that's when he started getting this skin tearing and splitting, that I really started getting angry, because I felt like I was being pushed off and like I'm acting like a hypochondriac, or I'm acting like a crazy mother, but I knew, like, I'm totally not. I am not someone that takes my children to the doctor unless there is something wrong with them.
Yeah.
I don't run to the doctor. And so by this point, I think I knew something was wrong with him, and I got really defensive because I wanted someone to listen to me.
Yeah. So you had seen 7 doctors by this time?
Yeah.
So then who were you able to get to, like, who made it was the geneticist? Yeah, but I was like a self-referral. Yeah. Like our plastic surgeon told me, he was on the craniofacial team, and I said, I want to see geneticist in the next appointment, because it's like a group of doctors that would meet for him. So he would have like, his plastic surgeon and his ENT and, his feeding team and like all these people, and they would have genetics available. Yeah. And he said, oh no, he's fine. He doesn't have like an underlying issue. And I just said, no child has this many problems, like in just so many areas of his body. And then I'm seeing all of these other things. But I, at this point, he had like a couple pediatricians, 2 family doctors locally, who all kept just telling me he was fine. Mm-hmm. And then, it was a self-referral for genetics. And I said, I still want to see them. I want to see them. Yeah. And then when we actually met with genetics, the head honcho, the big guy that had been there a long time, actually said he was fine. Yeah. And it was the fellow. And it was this fellow that, she was about my age, and she was a mom, and she was also pregnant. And I think, you could just tell, I think she understood, like, how desperate I was. Yeah. And, I remember telling her, I said, I know there's something wrong with him, and, to this day, we see her every year, and she's amazing. Yeah. How did it feel when you got the diagnosis? That's a good question. So I was devastated, reading I knew enough about it. It was devastating to look at that. But at the same time, I am definitely a fixer. I will hit it head on. Like, I want to know every single thing about this. I want to find not a good doctor. I want the best doctor
we ended up traveling to Baltimore to see Dr. Dietz when, locally, I would just bring up so many things, and I just want the best for, you want the best care, you want the most recent, what's going on with it. And if I don't have, that's how I deal with it. I need the most recent information because I can't fix something if I don't have all of the information I need.
Yeah.
And I know everyone's different. I mean, you hear about, people that go into like denial about it. And I'm the complete opposite. I want to know every possibility of the worst case scenario. I want to try to plan for anything that could possibly happen, so that I can fix it or prevent. If I can prevent anything from happening in any way, I would do it.
Yeah, and you're in one of the I states, right?
And yes, I'm in. I am in the I state. I am in Southwest Iowa, so not a very, up and coming area.
Yeah.
I'm like 15 minutes from the Missouri border. I'm kind of between like Omaha and Kansas City.
Okay.
Closer to Omaha. I'm about an hour, just over an hour from Omaha, about 2 hours from Kansas City. And it's definitely been a very, very big challenge in that area. Yeah.
So do you travel to Baltimore now every year to see Dr. Dietz?
So we actually, the plan was we were going to see him every 2 years. And then we actually had a cardiologist that came from, and I can't remember where she came from for sure, but it was the West Coast. I want to say, I don't know if it was Portland maybe, had come over, and she actually started, her and our geneticist, they run a clinic together for like connective tissue diseases, and she runs like the Marfan clinic.
Yeah.
And so we ended up like being able to see the two of them together, like his cardiologist and his geneticist. And that's gone okay for a little bit. But I think the more I learn about it, I think, at least for Jon, we're actually in the process. He'll start seeing Shane Morris in Houston, actually next month.
Awesome.
So we'll travel to Houston, because I really feel there's power in numbers, and you can get a lot of things done, when you have numbers of patients. And I think it'll just be a lot better for me as a mother, and for Jon, and for us it'll work. It'll work well.
Well, Shane Morris is great. She's got a lot
amazing.
of kids.
Yeah, she's amazing.
Yeah. So how has it been in the 5 years since you've known his diagnosis? Like, what's gone on? What kind of complications has he had?
So he does, I always say, like, when people say, oh, how is he doing? Like, you probably know as a vEDS patient, or, and as a parent, your first thing is just like, oh, fine. Oh, yeah, they're good. But, they have vEDS.
Yeah.
They're fine today. They weren't fine yesterday. They weren't, his biggest issue is like he has a lot of GI problems, and it's been very challenging because there is no good data. We don't know what is caused from, and you're limited as far as testing.
And that's like the no colonoscopies and endoscopies and stuff, right?
Yeah. So, we have a great vascular surgeon in Omaha. He had recommended that Jon have like a barium swallow test because of all of his GI issues, and that's fine. But he wanted us to see. He said, "Oh, like we'll need to get him into GI." And here's the issue with vEDS. So then I'm like, "That's fine. I will do that. Get me a GI."
Yeah.
And that's where care always falls off, and I'm on my own.
Because you don't have one.
No. And then I always say, and I still remember like being in the car after this with my husband after this last appointment, and because the nurse had told me, I'll call you, I'll get some names and I'll call you back. And I remember being in the car with my husband, and I go between like being really angry and then like breaking down and, sobbing. And my husband, I remember him saying, give her a chance. She said she'll call you. And I'm like, she's not going to call me. They never call me.
Yeah.
And he kind of was like, was trying to be, helpful, try to be positive. And that's when I get really frustrated and I get very emotional because, it's sad because you're on your own. I'm like, she's not going to call me. She's not going to get me a name. They never call me. Welcome to vEDS. It's sad. It's so sad. It's so sad.
It is. I remember I had a lot of GI issues when I was a kid, so I'm really curious about what his symptoms are like.
So his GI issues, he'll get like really severe stomach pain, to the point where, it's really debilitating. He will, lay on the floor and cry. He will, cry that his stomach hurts. And it kind of, it'll go on for hours a lot of times. And he'll get very nauseous. He'll get dizzy. He'll lay down. And then, we just try to comfort him as best we can. And then usually it'll end with him vomiting. And then he's fine.
Is the vomit normal?
No. Well, it'll be even like old.
Like undigested food?
Yeah, sometimes it will be, and sometimes it'll be from like the day before.
Wow.
And there's other times where he won't vomit, and he'll just have severe stomach pain. We were just in the emergency room on the 4th of July. Because it was so bad, he couldn't walk. I had to carry him. And I swore at that time that he was having a bowel rupture.
Yeah.
He was screaming. He's 7. He can't explain. All he knows is that his stomach hurts. He wouldn't let me touch his stomach.
Yeah. So what was that emergency room experience like?
It was horrible. It was, working on the collaborative, and especially the last 5 years, like knowing what I know, I'm the person also that like helps people like find physicians and get plans, and like I'm very involved like in the online community.
Yeah.
And about like advocating for yourself and your kids, and I guess you always think about no, you need to do this, you need to do this, but then, and I was prepared. I thought I was prepared. I had everything. I had all of the papers that I needed and the emergency forms and, notes from doctors, and I had an emergency plan signed by his doctors and what to do with this and this and this. And, I took him there. I had paged our vascular department before we went. They told me to take him, and I go there, and it's a huge level 1 trauma center.
Yeah.
Freestanding, like that's where he needs to go. And I carried him in there, and at first, we're quick, and then we sat there. And it was like an hour and a half before they even started an IV. And he had, in the severe stomach pain, like on its emergency plan, it says, you don't waste time with ultrasounds. You don't waste time. And it took 3.5 hours for them to do an ultrasound of his appendix.
And the appendix.
The appendix. And it was 4.5 hours before we got an MRA of him. And that was after I paged vascular again, because the attending told me that they could not get a hold of vascular. Mm-hmm. And so I took it upon myself, and I did it again. And then when people say you need to advocate, and you even hear like physicians, sometimes I feel like they're not even in touch with reality, and they say you need to advocate, you need to be their voice. That's all I've done for 5 years. Yeah. And not only for my son, but for vEDS patients and other parents helping their kids. And that's all I do. And I am not a quiet person. And I go, I am in the hallway on my cell phone, paging vascular, staring this attending down.
Yeah.
Because he will not listen to me. He refused to look at my paperwork. Refused. I mean, when they sit there, they sit there and they tell you, yes, we understand it. You don't understand it. If you understood it, we wouldn't be sitting here
Yeah,
waiting.
you would have ordered a scan already.
Right. And then after I paged vascular again, I'm assuming somebody from our vascular team called down, and it did not go well for this attending, because within probably 10 minutes he was getting an MRA, but that attending never came back in our room. He kept, and after that point he just sent his resident.
Mm-hmm.
And then I don't know how, and this is what's frustrating me, because I don't know how to fix that. And I've tried, and I know other girls that I've become close with that live in the same area, and it scares me to death to think if they were to go there with an event, or if my son were to go there. I mean, thank God it was not an emergency event this time, but it scares me to death to think if I would have to go back there if he did have a rupture or a dissection or something, or one of my friends there, because they're my friends. And to think about that is very scary. And so that's what I really have been trying for a while. Like, how do we fix that? Because that has to be fixed.
Yeah. It's a big problem, and I know that, like, I'm not going to get on my soapbox.
Right.
Because I get really fired up about
I know.
it. And, but we're trying so hard. I think we all try so hard in the community, and, like, we're such a tight-knit family.
Right.
That it's amazing, like, what you and Rachel do by calling people, like, on behalf of people, and, like, looking out for people who are having emergencies. You guys are doing such amazing things with that.
Yeah.
And, for those of you that don't know, like, Abby and Rachel, I feel like you guys, like, just comb through all of the posts.
I swear I feel like that sometimes.
And then you call Shireen. Or, I mean, the first thing on the comment I see from either you or Rachel is, have you been in contact with Shireen Shalhoub yet?
Right.
And if you haven't, like, one of you guys call her. And say, hey, this person's at this hospital, and they're having an event, and then she will call them.
Yeah.
She'll call the hospital. And it's truly amazing. I mean, it's heartbreaking that we have to do that together as a community.
Yeah.
But it's amazing what you're doing.
Thanks. And I feel, I think it's hard too, because you feel so close to even the people I haven't met, and I've met a lot of them. But you do, I mean, I don't do it just for Jon. I mean, that's what got me started, but I've gotten so close with so many people. They're like my family, and they're my friends. And when something is happening to them, it's very, it's scary, and we've lost some, and I'll talk about, like, my friend Jody. I was really close to her, and that was really hard for me.
Yeah. And I never met Jody, but Jody, that one was hard for me too. She passed away. It just felt like at the time we lost several in a row very quickly.
Yeah. And I didn't know, there were a few, that we had lost, and I didn't know them. I mean, I had seen them post some, but, with Jody, I was so sad because I never got a chance to meet her in person. But, I loved Jody because her son had vEDS, and he was a little bit older, but definitely seemed like he had the personality when he was younger, like Jon has, because we talk about all of the things that he would want to do, and she hated telling him no, and she had always had such great advice for me, and I also appreciated it because she also had vEDS.
Yeah.
So I think it helped me as far as, she was the mother of a son with vEDS, but she also understood it as a patient. Mm-hmm. And, that was really, really tough for me when she passed away.
Yeah. about to ask you something. You said something, and I was like, that's what I'm going to ask. And then I lost my train of thought. Jody was really, it was hard. I did that song for Jody and all of them in, like, December on my YouTube channel. Like, and then was that last night? No, it was the night before last night when I sang it at the award ceremony.
Oh.
Here. Like, we had, like, a talent show and a dinner, and it's the song, like, I'll Fly Away.
Right.
And it was so, like, it just spoke to me so much after she died. And it was sad.
And, you know, sometimes I think people probably, I guess if you weren't in the group, it's so odd. And sometimes I think when people are newly diagnosed, I wish they had a way to find us because it's amazing. And I still remember, I'll talk about our friend Brandy. I don't know if you heard this story. It's like my favorite. It's my favorite. This is probably the best thing that has ever, like, in 5 years. So I remember Brandy, and I hope I'm going to send her this because I want her to listen. So she lived, so she was in Texas. I think, she was in Texas. And so she was pregnant, and she had vEDS, and she was very pregnant. And I remember finding her, she posted in a group, and I don't remember if it was, like, on the Friends page. And I remember her being very pregnant and with vEDS, and she posted about, basically she was going to have a C-section at a rural hospital was the plan. And I remember reading that, and I'm like, oh my gosh, I'm thinking, you know, it's like 10 o'clock at night. I'm like, no.
Yeah.
You know, I mean, and it literally, like, it scared me to death because I'm thinking to myself, this can't happen. Her doctor had sent her to, like, a high-risk OB. The high-risk OB said she was not high risk and, like, didn't even understand.
What?
Didn't even understand why she was there. I think it sent her twice, maybe. That, like, it could all be done in her rural area. And I remember messaging, so I messaged her, and I remember telling her, so she's telling me this story, and I'm like, that makes me, like, really nervous. And she's like, I'm really nervous, but I don't know what to do. And I'm like, okay, no, like, you are not having this baby at a rural hospital. Like, you have vEDS. I was like, no. And I remember it being, like, 10:30 at night, and I remember being so scared, like, oh my God, what if she goes into labor?
Yeah.
What happens if she goes into labor and, like, they take her to a rural hospital and has a C-section? I'm, like, worried. I'm, like, scaring. I was so scared, and I'm, like, you know, psyching myself out, and I cannot sleep at this point. Like, there's no way I can't sleep. And I remember messaging Rachel. I was like, Rachel, because Rachel's in Texas, and I was like, oh my gosh, and I'm, like, telling her all this stuff. I'm like, they said they're going to do a C-section at a rural hospital. I'm like, she can't have a C-section at a rural hospital. I was so scared. I'm like, you know, and then Rachel can't sleep. And so Rachel's messaging her, right? And Rachel is, like, telling her, I'm like, no, you have to have it at a level 1 trauma center. You need a high-risk OB. You need to have vascular in there, too. You need, you know, is telling her all these things. Like, Rachel's reaching out to, like, you know, physicians she knows and, you know, the high-risk OBs. And she ended up, I'll try, I just ramble. And so anyway, she ends up getting amazing care. She went to the huge hospital, had I think she ended up having vascular in there. She had a healthy baby. We knew, like, she was scheduled to have it done at, like, however many weeks. And then the day of, her husband sent us all these baby pictures. And I was like, oh, my gosh. And her baby does not have vEDS.
That is amazing.
That is, like, the best story ever. Like, and that's why, that's why I do it.
Yeah.
Is because of that.
Well, it's amazing what you guys are doing. And you mentioned, like, people finding us and getting into the community. Yeah. I've noticed people when they reach out to me and, like, hey, do you have your genetic report? Because I can get you into this group.
Right, for sure.
And, like, we are a really tight family, and I want that. It's growing a lot more rapidly now.
Oh, yeah.
And it's very exciting because, you know, there are people out there that don't have any support like this.
Right.
And
I remember
need that change.
And I remember in, like, one of the groups online that had been, like, pretty stagnant for a while, I remember being on there and like I made a post and I can't remember. And all of these people just flooded this post, like, because this group had been quiet for so long. And all of these people, and oh my gosh, I bet it was within a 3-week period, we had to have had at least 30 people that were confirmed vEDS. I mean, just like out of nowhere.
Yeah.
Like, I'm here. And I'm like, and I still remember like Francis and Kat, and they're like, where are you finding these people?
They asked me that too.
I'm like, right? And they're like, are they confirmed? I'm like, they are sending me their genetic tests. Like, they're desperate. Like, they are, I really believe a lot of people are desperate for information, but they don't know where to go.
Yeah.
They have no idea. They have no idea what mutation they have. They're like, I had no idea.
They don't know any of the information.
No idea.
Pol 3A1.
Right. Yep.
That's what I get a lot.
I have
right.
I'm like,
well,
yeah.
For what kind?
Right. No idea, and a lot of times, like, as I'm typing, they're sending you their genetic report.
Yeah, no, please tell me what it is.
Right. What is this? What is this? Yeah.
Yeah.
My doctor said there's nothing I can do about it. I don't need to test my kids. I don't need to.
And
I'm just like,
oh
my gosh. Have you had and yeah. It's insane. It's crazy.
That is insane.
It's crazy.
Especially if you have it and you're not going to test your kids. I mean, at some point, you don't have to do it immediately,
right.
but at some point,
right,
you probably should.
Mm-hmm.
What are some similarities that you've noticed between Jon and some other kids with vEDS that you've met?
Oh my gosh, have you seen Jon?
Mm-hmm. He's cute. He looks a lot like...
He is like the poster baby for vEDS. Did you see our picture? Me and Rachel, we took a picture of the boys, like Jon and her 2 boys,
mm-hmm.
at the Marfan at the conference in Houston, around like the sticker they had on the floor.
Yeah.
And I said, oh my gosh, they're like the poster boys for vEDS. He just had, he looks, he just looks like a little vEDS boy. He's so cute though, and he has a huge personality. But he does definitely, he has attached earlobes. He has the very thin nose, kind of pointy. He has the big eyes, the almond-shaped eyes. He has, thin upper lip. He has, very thin, translucent skin. It's very see-through, like on his chest and his back.
Yeah.
Yeah, he's definitely, when they say, oh, you can't go by facial features, like you would walk in a room and see Jon and be like, he's got vEDS.
Yeah, and I've done that with some people.
Oh, yeah.
It's crazy now that I know the facial features. Like, once you've seen so many people with them, it's like you can pick them out of the room.
Yeah.
When you walk in, you're like, oh my gosh, do I tell this person?
I know. It's crazy.
Pause for airplane. It's like airplane mode here. This is so cheap. I should leave this in.
Right? Be like, airplane. Move one. Leave one in there.
Okay. So is there anything else that we haven't talked about that you want to talk about?
I would say, like, it's very difficult. I think it's for me. I'll say, like, from my perspective, I know that it's like a personal decision to get your kids tested, but just seeing, so like Jon was tested when he's 2. He doesn't know any different, and he's always been like this. And his friends, like, he's grown up with the same friends, in our town, and like he went to preschool with the same kids.
Yeah.
And I think that it is definitely easier for other kids to accept them the sooner they find out, and that's what they're used to. And it's definitely, I think, been easier. I cannot imagine, like, putting off, I know it's a very personal decision, but putting off until they're older and then kind of, like, dropping this on them.
Yeah.
Because I definitely feel like it's definitely easier for Jon, because he hasn't ever known any different. And I see kids that aren't diagnosed until they're 10, 11, 12, 13, and it's very devastating. And so that would just be, like, my perspective as a mom, getting him diagnosed when he was young, and that's just that's just him. That's just the way he is.
Yeah. So does he know he has vEDS?
Oh, yeah.
Does he
He'll
know
tell
all
you he
about it?
does. He'll say, I have vEDS. This is so terrible. When we went on his Make-A-Wish trip, he was so excited to be there. He's like, aren't you glad I have vEDS? Isn't that terrible? He's like, and he has his little genie. He has his little genie pass because he can go on any ride and go up like the exit. He doesn't have to wait.
Yeah.
And he's like, aren't you so glad I have vEDS, to his brother and sister? And he's like got his little genie pass and he's like flashing around like Joe. And then he's saying things, he'll say, aren't you glad I have a bad heart?
No.
And I'm like, John, no, don't say that. But he didn't care. He was, at the time, he's 7. It doesn't, he just has vEDS. It's just, But no, he does know. As well as he can know anything about, he's 7. Yeah. He does, he knows he just knows he can't do contact sports. We let him swim. We have a swimming pool at our house. He swims all the time. We try to limit his diving, but we do let him kind of dive at home, but he's also not off a diving board and it's like equal with the deck.
Yeah.
But he did swim team, so he can't dive off the divers. We let him go off the diving board, but we try to say, go straight in. Don't belly flop. Don't do it right, because he's very, very active. He's very active. So, yeah, he knows he has it. And he knows what can happen. Sometimes he gets a little gruesome about it. He knows that. He'll tell you, that he gets hurt easily, that his skin rips. He knows he takes heart medicine. But as far as like cannonballs, or if, he'll do cannonballs in the pool and, but he knows not to belly flop, but he'll tell you if he belly flops he'll tell you, like, what he told someone, he said, if I belly flop, my insides might explode. Like, right? I don't know. And but he says it like jokingly.
Yeah.
But we tell him, I explain it to him, like, it is hard because he's also 7, so he thinks doctors can fix him no matter what. He always thinks he can be fixed. And so we have had to have a conversation, you're really, really hard to fix. Because like we go to the doctor now and he gets his tests and they're taking care of him and he's on heart medicine. Yeah, they take care of me. And like his surgeries and procedures is all, pretty planned out and everything goes well and you're prepared. And so it is a little bit of a struggle to say, if there isn't, we really have to prevent something bad from happening because it's not always that easy.
That's got to be hard as a parent.
Yeah.
But it's good that he knows.
Yeah, he knows. He'll tell you all about it. Ask him. He does, yeah.
I never know, like, when I interact with people's kids, I never know, if they know or not. And so I'm always just like, hey.
Yeah. No, they know. And he was so excited. When we were in Houston, that was the first time he had ever met other kids with vEDS. Mm-hmm. And he was so excited. And he said, they have vEDS. They look like me. I knew he had vEDS, he loved it. He loved it.
It is awesome to see when everybody gets together. It's just, and I love that the kids got to get together when we were in Houston.
They had so much fun.
I heard a lot of good things about that.
It was amazing. It was amazing. And yeah, he loved it. He's still talking about it.
That's awesome. Well, thank you for doing this and for everything that you do.
Of course. Thank you for everything you do.
I hope to be around for a long time to keep doing it.
Yes.
That's my goal.
Mm-hmm.
So thank you, everybody, for listening. This was Staying Connected, and this was Abby telling her son's story, Jon, with vEDS, and her own story with it. So thank you for listening. We have a new episode coming out on the last Sunday of every month, and I'll talk to you soon.